Chairman, we are now live.
Thank you. Good morning, everyone, and apologies for the delay. What's happened is that we had some technical issues with the council chamber that we were expecting to hold the meeting in. So we had to decant to one of the committee rooms where we've got audio and visual, because the cameras were on the blink in the chamber due to a previous power cut. So welcome to everyone, and just technically we have formally adjourned the meeting from the chamber into this room. So welcome to this meeting of the Health and Wellbeing Board. I'm Councillor Graham Bridgman and I'm Chair of the Board. As always, we are holding this meeting in a hybrid format, so there are members in the meeting room and there are members joining us by Zoom. We have a quorum in the room. I've got a list. I'm just going to, as I look around, make sure that the ones I'm reading out here. Councillor Dominic Burke, Councillor Lynn Doherty, Councillor Steve Moss, Councillor Joe Stewart, Councillor Mark Vickers. Welcome. We've also had Paul Coe, April Pebbody, Gary Paulson, and Dr. Mike Feldman. And I think I've covered everyone. And I have Gordon Oliver clerking the meeting and Ben Ryan as the Zoom host. The other members of the board that we are expecting to attend virtually, I hope that we will have John Ashton, and I also hope that I will be correct in saying it's Professor John Ashton. John is the new interim Director of Public Health for this area. We also should have, in due course, Jessica Jundig-Evans, Gail Muirhead. I can see Sean Murphy is attending. I can see Sarah Webster is attending. Councillor Rick Jones is here, and we are expecting Fiona Worthy. So as people join, and obviously because of the technical issues, people may have left the Zoom meeting and not yet come back into it. We'll see how we go. Also, like to welcome, and I hope he's it, because he's one of the items on the agenda this morning, is Rob Bowen from the Bob Integrated Care Group. As always, we very much trust being live streamed on YouTube, and just technically only those members of the board who are actually physically in the meeting room can vote on any item. If there is a need, what I will do is I will look for an indicative vote of everybody, and then we'll take the vote in the room. And as always, this is a Thursday, and as always, there is likely to be fire and lockdown alarms. So if those happen while we're speaking in this room, we'll just let them pass and then carry on. And finally, let me reflect that this is the last meeting of this Health and Wellbeing Board before the elections in May. And therefore, to the extent that any of us in the room are no longer in the room after May, I'd like to thank all members for their diligence and joining in and engagement, particularly their engagement with the Health and Wellbeing Board and all that it does. And I'd also take this opportunity to thank officers and those officers from partners who have supported us, joined in, and in particular our members, and contribute to the subgroups of the Health and Wellbeing Board, where a vast amount of the work that we get on and do is done. So thank you all. Move on with the meeting. So the first item on the agenda, members, is as usual apologies. So I'll ask Gordon whether we've had apologies.
Yes, Chairman, with apologies from Dr. Janet Lippitz, Will Orr, Matt Hensby, and Jim Muirhead.
Thank you. Now, the next item on the agenda, members, is the minutes of the meeting on 23rd of February. Does anyone have any amendments they want to propose to those minutes? I will propose them for the chair. I will look to my normal. We do a double act, Lynn and I propose she seconds, or she proposes and I second. So thank you, Lynn. So members, all those, I won't take any big vote. All those in favour of the minutes in the room, they are agreed, and there they are, signed in anticipation. Right, moving on. Let us look at item 3, which is actions that have arisen from the previous meetings of the board. So there are, I think, 4. I haven't been pointed to any of them specifically. Indeed, I note that they are all labelled as complete. No, I'm on the wrong page. Do apologise. I'm looking at the second page. I was getting very excited by a sea of green, but on the first page there is some amber. So members, I'm not going to speak to any of these items specifically, but I will take questions. Martha.
Yes, thank you, Chair. Just the 211, when there's going to be a presentation, children care to the speak to the board, and I was just wondering the corporate governance board, whether that could be advertised when it does happen to the wider group on the council, because we get a very limited number attending that, and that sounds like an important thing that council, not particularly new councillors, with some value from. So just before the wider advertising we're going to say that might happen.
Dominic.
To Martha, is the suggestion that we widen the attendance?
Yes, only maybe on that occasion there's going to be a report. I think widening attendance, I mean, people should know that they can attend anyway. I think you often mention this, that not enough councillors come to these days.
Yes.
And we just have sort of parties, but to make it more widely known that this is happening, so people can attend, particularly people who want to know more about what council does.
Something we can discuss, certainly.
I think that suggestion is something, because after all, we would be inviting members anyway, but given that it is a new session of the council and there will be new members who won't be aware of their corporate parenting role and responsibility. So we'll take that on board, and that would become part of the members' development process.
Could I just ask, only 218 the asylum seekers meeting happened. Was that did any companies attend that? So that was officers that attended that meeting from different agencies, just looking at the Health Watch report, and did the Health Watch representative
well, I'm going to look to Sean, who appears to be one of the action leads, and appears to have hopefully been there, or at least will know the answer. Sean.
Yes, thanks, Chair. I can't. The camera's not working, but just to So we have met internally several times with around the asylum facilities and the implementation. We have discussed the implementation of the Health and Wellbeing Health Watch report. Those meetings do also contain basically partners as well. So we are mindful of that, councillor, and we will take that forward and make sure basically that we do what we said we would do, which is to look at where the best practice arising from the report can be implemented.
Thank you.
Thank you. Any other comments or anything to raise on that? Okay, thank you. Moving on. So next item is standard declarations of interest, apart from the standard declaration or declarations that are in the agenda. Does anyone have any? Dr.
Yes, regarding the pharmacy item, my practice is certainly with an attachment and will be implemented.
I guess that's no personal interest, because this is after all the reports and the contact. So you're going to stay in the room. Thank you.
I was forced to carry certainly one of the tasks in my road and affects my residents.
Indeed. Any others? Those will personal interest, so we'll be in the room. Fine. Thank you. So next item is public questions. I don't believe there have been public questions, but I'll look to my right.
Nobody was interested.
And similarly, petitions.
No petition.
Right. So we get on to the meeting. So membership of the board. As I anticipated at the last meeting, April has replaced Steve Welsh as in the new role of interim service director for community wellbeing, and Zoe Campbell, welcome her, she's not here, but welcome her back to the council in the role of your substitute of this board and then other roles within the council. As I said, and in anticipation at the start of this meeting, John Ashton has now replaced Tracy Daskowitz as Director of Public Health for Reading and West Berkshire, And I had a very useful, I think a number of us in the room had a very useful meeting with John recently, and look forward to working with him. And finally, Kate Reed has replaced Lorraine Adams as the sub for Matt Hemsley on the board. That's feasible to note. I think we just note those changes and move on. So we now get on to the joint forward plan for the Bob Integrated Care Board, on which I've sat through a number of presentations as I was in the room have related to this, but there will be those who haven't seen it and haven't had the benefit of Rob's conversation and introduction. So Rob, I'll go over to you if you explain who you are and why you're here. Off you go.
Brilliant. Thank you very much. So my name's Robert Bowen. I am the Acting Director of Strategy and Partnerships for the Bob Integrated Care Board. Apologies, the sound quality for me certainly is really poor, so it's quite difficult to pick up some of the conversation that's happening in the room. So just when we get onto the conversational bit, hopefully you can hear me okay, but when we get onto the conversational bit, it is quite difficult to hear some of the conversation that's happening. The reason why I'm here is because as colleagues are aware, one of the ambitions of working together in an integrated care system is to try and foster and support as much collaboration between those organisations and institutions that are part of the provision of health and care to our populations and communities. So that ambition for us to do more together.
Rob, can I interrupt you? Is that sound quality any better?
Yes, that is better. Thank you.
Well, let me apologise to you and apologise to those others zooming in that it was a which set of microphones we selected on Zoom. So apologies for that, because we've had this issue before.
Yeah, well, excellent technical understanding. Thank you. Yeah, so kind of a real ambition is about trying to do more together and to do that better. And colleagues will be aware that we're doing that at a system level across the whole of Bob, and we're really trying hard to do that at place level through the work that Belinda and Sarah and others are leading. Over the last 6 months, one of the ways that we've been able to do that is through the development of the integrated care strategy. That was a piece of work that colleagues in the room had been involved with, as had many others across the system, which was signed off by the Integrated Care Partnership at the beginning of March. So that was that is the group that's sort of representing all of the different stakeholders across the system. So that has now been agreed as the direction of travel for us as a system, with a really strong focus on prevention, on tackling inequalities, and improving access to some of the services that we provide, and doing that all through partnership. In response to the integrated care strategy, different bits of the system are now expected to be thinking about what does that mean in terms of the delivery plan. And the NHS are mandated to produce an annual plan, which is grandly called the Joint Forward Plan, which sets out how we try to balance two things. One is the balance of that local ambition that we've got articulated in the integrated care strategy, and the other is some of the shorter term operational requirements that the service is facing day in, day out. So the Joint Forward Plan is trying to describe a 5-year delivery plan. It's a plan that is updated annually, but really clearly trying to get the balance between the short term and setting that foundation and starting to achieve some of that longer term ambition. What I've circulated, lots of work has happened really over the last 2.5 months, trying to pull together lots of information about how different bits of the NHS will be responding to that integrated care strategy and the ambition that we've got there. And I've circulated two things. One is a link to a really big document. So it's 189 pages long. It's really big and it's really detailed. it's detailed because we've got so much of that delivery plan information in there. We've also circulated a summary document, which were in the papers that hopefully people have had a chance to look at. Really importantly, those documents are not the final version. They are things that are in draft. And what we are seeking here is really just to make sure that members are aware of the opportunity to provide feedback and to help shape the plan detail that is in there. There are really two bits of it. If we think about the structure of the document, there's the delivery plan and the detail of that I've mentioned, but also at the front of the document and at the front of the strategy, we've set out 4 key challenges that we know that we've got to be working across all of our different system partners to address, which are the challenge of inequalities and tackling inequalities, a challenge of trying to shift the focus of our attention from being a very acute focused system to actually doing more to keep people well and healthy in their communities for as long as possible. Doing more to tackle the way that people experience our services, particularly with respect to long waits and struggles around access. And then the 4th challenge is that of sustainability, particularly looking at some of the financial challenge that we've got within the NHS and what's the sort of long-term approach that we're taking to addressing that, but also recognizing that we've got some real challenges that we need to front up to and we want to do as a whole system with respect to our workforce. So those are 4 things that we've got where really we know that we need to be working systematically with partners. And the ambition that we've got there builds on a really good workshop that we had at the end of March, which gave an opportunity for different organizations and different individuals from across the system really to input as to the best way that we can work together to achieve progress in some of those challenges. So what I'm looking for from this meeting is really to make sure that people are aware of the opportunity to provide feedback on the draft, but also to remind colleagues in the room that there is a formal requirement that is coming in June for the Health and Wellbeing Board to provide an opinion on how well the joint forward plan aligns to and will support delivery of the joint health and wellbeing strategy for Berkshire West. And let me stop there. I was going to say a little bit more about how we might do that, but I think let's stop there just in terms of any initial reflections that people have had, and then we can talk about next steps.
Indeed, thank you. Members of the board who are not in the room, I'll be looking for Zoom hands should you wish to speak, and hoping that I spot them. And if I don't, hoping that someone will point me at them, because I haven't got Zoom up on my screen, so I'm relying on the screen in the room. From the chair, let me firstly say I thought that some of us in the room were at that session you spoke about, the workshop session, and I personally thought it was very useful. I thought it was very positive. I thought the mood in the room, and there were let's reflect for those who weren't there were a lot of people engaged in that process from right across bowl, from all flavours of the system, and the mood and the interaction and the engagement I thought was very good indeed. That I thought, from my perspective, the right kinds of messages were being pushed back at you as system, in particular from those of us local authority level, about that interaction between what we're trying to do here and what we're trying to do locally, what we're trying to do in our health and wellbeing strategy. Next, let me reflect that there is, I think there is some cynicism in the system about the ability of this new beast to do what it needs to do, given the financial pressures on the NHS in particular. We know that a number of the acutes are going to become have already will have at the end of this financial year just gone fairly substantial deficits, and that they are starting the year with fairly substantial deficits which they need to deal with, and that there is a savings target generally within the system. So I'd like you just to reflect the ability of the system to deliver what I think is a phenomenal piece of work. And I know you have put a hell of a lot of work into producing this. So I want to thank you personally. But generally speaking, we need to understand our ability to do what we're setting out to do. And finally, in terms of the role of the Health and Wellbeing Board in what you've just said about coming back in June or whenever in order to give our formal view on this strategy and the way in which it will and its delivery plan will link into our strategy and our delivery plan. I am going to obviously task the various groups sitting underneath the Health and Wellbeing Board, each to look at their individual, because obviously our delivery plan identifies who's doing what. So I want the people who are doing it to look at the question, is this strata of our own delivery plan linking into what you are seeking to achieve system-wide and subsidiarity down through the system into that, so it comes in the right level. And finally, you'll be pleased it's finally, one of the things that really came out, and I think you've reflected on this a bit, is the desire to move stuff upstream, is the desire to really engage with the prevention strategy so that ultimately, and this is going to take a very long time, we actually don't have the pressure on the acutes that we currently have because we've dealt with things far, far earlier within the system. So those are reflections from me as the chair. I'll now go to Martha, Councillor Vickers first, and then I'll come to you, John. Bear with us a moment.
Thank you very much. It's really good to hear that prevention is being put, at the forefront of everything. Although, as Graham just said, it's sort of easier, to put forward these opinions, but the action is difficult. I suppose my comment is more, down to below the strategy level to some extent, but it's what us as a council can do. We have we have maps who sits on here for housing, representing sovereign, and housing is increasingly being seen as a sort of crucial factor in people's health and well-being, and more, particularly with young people. And it's not just that we haven't got enough of it, it's the quality of the housing and the way our social landlords, private landlords manage this. And I think we're all, particularly at the moment, probably meeting more and more people as we go around our areas who are having problems. And my particular concern is with the smaller social landlords and the private, and whether this council can improve its liaison or its influence over these landlords, because this is a crucial preventative area. And in meeting the people in these particular circumstances, you're meeting some of the people with the most poor health outcomes, and the type of housing they're in is critical, not just the damp and the mould, and this is part of it, but the actual fact that they can't engage with these very distant and very uncaring landlords quite often. And I'd like to see us having a stronger influence on that, although it's only one aspect. I think it's a big aspect. And my other comment was going to be access to GP surgeries. I think the GPs has always seen, and it was overwhelming on the GPs, as our sort of point of contact for everything, which has been too much for GPs, but they are very accessible and within the community. And particularly since COVID, they seem less accessible, or particularly less accessible for certain sections of the population. I think that there's a sort of an overwhelming sort of demography that's always on the GP's back, and then others that never seem to be there or find it more and more difficult. And changes happen in the GP practices. I mean, my own has gone from having, you could access and get conversations on email, which lots of people thought was fantastic. And then suddenly it stopped. And I don't remember anybody telling me this is going to stop. I think I got a comment at the surgery, and they've gone back to what they call the old system. And I think this is probably because they were overwhelmed, maybe with inquiries from people, because people found this really, really useful. And maybe it could have been triaged better or something. But changes happen, and they don't happen with proper consultation. And I don't know why you can't have two systems running alongside each other. So GP surgeries have got to be accessible. We've got to expand them as health centres in the community, because, you know, whatever can be done to make them seem more welcoming, more open, more of a sort of one-stop shop for health issues. Okay, thank you.
Rob, do you want to comment on that before I go to John?
So let me just pick up the comment about deliverability, and then those two other colleagues. So deliverability is, you're absolutely right, is a real challenge. And as I said, the plan that we're trying to articulate is always balancing the short term and the long term. And as we get into sort of finalizing our financial plans within the NHS, that pressure is increasing and continues to be something that we are really striving to make sure that we are laying the foundations for that longer term change. And I hope that as we read through the detail of the draft of the Joint Forward Plan, what comes out is that the ambition for 23-24, particularly recognizing the financial position that we're in and the pressures that we know that the system is under, is where we are trying to say there are one or two really critical things that we need to get right across the system that will lay a foundation. It's not necessarily going to make the change in 23-24, but it will lay a foundation that will allow us to build momentum and start to make some of those longer term changes that we want. So I hope that we've got that deliverability balance right, but recognizing it is a balance. Specifically on primary care and trying to think about general practice, what the Joint Forward Plan does is recognise the role of primary care is absolutely integral to the way in which we are successfully providing health and care support to our community. And primary care has got to play a really important part in that shift of focus from the acute into the community. So one of the commitments that we're making in the Joint Forward Plan is to have a really deliberate look at the way in which primary care will be provided, and to set a 5-year strategy for primary care services within the system, so that there is a much more detailed piece of work that we are proposing that we will undertake over the next 12 months that will set that vision for how we expect to support primary care in that really important role. So I absolutely agree with the comments that were made, and we need to do some very deliberate planning to make sure that the models that we're putting in there are sustainable. So that's important. In terms of housing, John will probably say more in terms of housing and actually the role of local authorities working with partners, absolutely, to tackle some of the wider determinants. But that was a really important part of some of the information that we got into the integrated care strategy document.
Thank you.
Thanks, Rob. So, John, you probably didn't hear me introduce you and welcome you aboard because of the problems we had with sound. But let me now formally welcome you aboard as the Interim Director of Public Health for Reading and this council, and invite you to speak. And don't forget to unmute.
Thank you. Thank you very much. I apologise, the dogs are barking here. But thank you very much. Yes, I did hear most of it, actually. So first of all, thanks very much, Rob, for that succinct account, because I'm, in week 1 here, so it's very helpful to me to know where we are. And also for the comments from the chair, and I assume that was another councillor that spoke, was it? I couldn't quite make out, but thank you very much, because I think I'm on the same page as you. The points I would just make, I'm hoping my wife's going to shut the damn dogs up and then you'll be able to hear me. is that, you know, the main issue here is cultural issue on the deliverability front. You know, it's a very British thing to have these very elaborate plans and to say you're going to do them and then do nothing. And the cultural aspect to this is really imperative to address this, to get the commitment from everybody to really follow through. So that's the first thing I would say, because that's top and bottom of this agenda. The second thing, I've just spent a year working in Northamptonshire as interim director there, and there's a sense in which the integrated care agenda has become an industry with large numbers of meetings that really preclude people doing the work they need to do. And I just warn against that, because, you know, we need to have efficient ways of doing this. There are so many layers now to this, with the place-based working and the borough working, and then the big ICB footprints. You finish up with strategies coming out of your ears before you know where you are. And we need to have a simple, common pathway of what we're trying to do. So those are my two main points. But yes, primary care at scale is key to this. But I've heard no mention so far this morning of self-care. And self-care is really fundamental to this agenda as well. In an age of an aging population, you know, the bad news for those of you who haven't reached my age yet is you all finish up with multiple problems. And unless you have self-care as the first line of attack, then you finish up with these huge pressures on the system. And we need far more attention paid to building resilience from the school age onwards for children leaving school who have basic knowledge about how to handle common conditions, through to peer support for people with long-term conditions, like type 2 diabetes, which I have. But there's a whole suite of long-term conditions which are best managed in peer groups supported by the formal system. And we need a strategy for self-care, because community provided care is 90% of care. You know, the NHS is only 10%. And we really need to support the lay care system as a primary priority. Then primary care at scale has to be the next stage. So we've got to turn the system on its head. Instead of working backwards from the hospital into the community, we have to work forwards from self-care through primary care at scale, through to secondary and tertiary care. And just finally, on the housing point, you know, in a simplistic sense, what this agenda is about is keeping people out of hospital and regarding all non-acute or all acute admissions to hospital as in some ways a failure. That planned care is what we're after, keeping people out of hospital and getting people out of hospital. Now, I don't know what the situation is here, and I look forward to an early chat with Rob, but you know, from the moment somebody comes near the hospital door, they should have a discharge plan. And part of that discharge plan needs to be informed by having a housing voice on the hospital board. Now, whether there's a housing voice on the hospital board or not, you know, it'd be interesting to know. I'm ignorant at this stage, because so many of the people who are stuck in hospital are there because they can't go back where they've come from. And you would really need to have that perspective in everything that the acute sector does. It isn't just about youngsters being unable to get on the housing ladder. It's about the fact that once you get to your 60s, you need to be planning the rest of your life in terms of being able to stay in the same place and not have to be seeking new accommodation when you've had a crisis. And that requires a strategic approach to housing at a borough level. So, you know, there are a lot of points here, but I'm very happy to pick them up with whoever's interested subsequently. Thanks, Chair.
And thank you, John. That's a refreshing comment, and I know you haven't even been here a week yet, and therefore it is interesting to see someone with the vast amount of experience that you've got come into the system and view it with a fresh pair of eyes from our point of view. And I think it's very refreshing having that conversation. Before I come back to you, Rob, I'm just going to ask Paul just to reflect on what's John mentioned. I don't want to widen this into a discussion about hospital discharge. We are here to effectively note what is currently on the table as the strategy under delivery and anticipate how we go forward with it. But given what John just said, I'd just invite you to say something, and then we'll come back to Rob, and then we'll wrap this one up.
Thank you, Chair.
Apologies, Heidi, after you.
Thank you, Chair. Yeah, so entirely agree with the messages that John's just set out, and your messages also about the positive engagement on the plan. John, let's do a briefing session on acute settings and the discharge piece particularly. I think the messages that I will give you will be very, very similar to what our colleagues in Reading Borough Council would say in terms of the challenges. The care market is a challenging place, albeit that currently, touching wood, the domiciliary care market in West Berkshire is holding reasonably strong. So we have some issues, but it's not terrible by any means. I would certainly agree with all of the principles in terms of one of the challenges in this process is that certainly coming from a social care background, the language you use is different. We're trying to operate a strengths-based approach, trying to make sure that we hold people at their well-being for as long as possible. So we'll work through the linguistic differences to come up with a coherent approach, I'm sure. Thanks.
And Dr.
Thank you, Chair, and thank you, Rob, for this. And I was part of this development, sort of the living well. But I think my key thing that I want to say that echoes what Councillor Vickers has said, and that echoes what John has said. What there's not enough investment in is comms and engagement. This is going to be a significant cultural change, which will require behavioral change. It's a mammoth shift in how we're doing prevention agenda. And that will probably be one of the key things I mention later, is comms and engagement from a level of something is changing within your GP surgery. How do we involve the patient in that decision making? How do we communicate that out to the population? How do we get the agenda, the prevention agenda, that everybody is bought into it? Because it can't just be us in health driving this. It can't be the councillors coming up with lovely slide decks. How do we make the people want to take exercise? How do we make it cheaper to buy healthier food than buy fast food? How do we? It is a mammoth change, right? Not just more tablets, but exercise and lifestyle. That will require comms and engagement, professional people to make it sound appealing, to make it sound achievable. And there's certainly not enough in our current system. We may have pockets within the council, with health, within the trust. I think collectively, if you put it together or have just a different approach to it, but whatever we're doing in comms and engagement, it's not enough. Thank you.
Thank you. Rob, final word from you, and then we'll wrap this.
Really, really helpful conversation. Thank you all. I'm not going to come back on each of those comments because I think they're all valid and good things for us to be thinking through. So thank you. And could I Gordon, probably through you, just remind people that we have a formal engagement site, and I've sent the link to Gordon this morning to circulate to the group. So what I would ask is that if people have capacity and are able to contribute and provide feedback, we would be really welcoming of comments that people have got. I guess at a minimum, what I'm asking for from the Health and Wellbeing Board is, given the importance of joint working, given the importance of trying to move forward together, if there is anything in here that is going to make it difficult for you to endorse this as a plan, please we flag this as soon as possible, rather than wait till we're into the sort of June process where we're asking for that formal engagement. What we're trying to do is, across all of our system partners, is to make sure that we're going through this engagement to end up with a really positive ambition that we're all aligned around. So it would be really great to get your feedback.
Thank you for that. And I think, therefore, I just come back to saying through the steering group, we will want all of the subgroups to engage and then deliver. Now, whether they engage individually or whether they engage through a sort of joint submission from the Health and Wellbeing Board, and that isn't to stop any individual member of the board engaging directly. And then if members aren't members of one of the subgroups and want to engage, please, I'm going to make Gordon a funnel for all of this so that we fill this all together and make sure that we've got a common view to come back to you with, and in good time. Okay.
Great. Thank you.
Thanks, Rob.
Okay, thanks all.
Thank you. Let us move on. Item 9 is terms of reference for the steering group. Now, members, just to remind you, you have in your pack the terms of reference for this board. You've only got those as an aid memoir. You've now got a proposal for the steering group terms of reference. Now, in each case, what's going to happen is all of the sub-bodies are doing terms of reference at the moment. I've very recently looked at the BCTP terms of reference, at the Children's Prevention Early Health Partnership terms of reference, and I've also looked, and one of them we will be coming on to shortly will be the Pharmaceutical Needs Assessment Subcommittee. You know, just we like an acronym. Terms of reference, and I also looked at Local Housing Integration Board. So that all of these sets of terms of reference would eventually come here because they are sub-bodies of the group, and the idea is that whatever is the senior group takes a decision as to the terms of reference for groups below it. So, for example, the Health and Wellbeing Board terms have been agreed by Council. So, if there are there any questions relating to the what you have in front of you for the terms of reference for the steering group? No, sorry.
I'm talking the board. No, that's fine.
You sure? So, members, what I will ask, we do need to formally agree these, so I will propose them from the chair. Does that find a seconder? Thank you, Councillor Doherty. I see no hands going up in the virtual room. Gary.
There's only one thing, in terms of the representative for the voluntary community sector, I think it might be helpful if it were a representative of the Council for Voluntary Service, which happens to be us at the moment, but I think that way you always go.
Can you point me to where we're looking?
Just find it again.
Page 55.
I've lost it. It's the makeup of the steering group.
Membership.
5.4.
No, 5.4 is the board. I'm looking at page 58, 4.1 as the. It's got a representative of the Voluntary and Community Centre as one of the reps.
Yeah. I thought we were looking at the steering group.
Yes, I'm looking at the steering group.
I can't find the page. Representative Voluntary Community. Yes, the final bullet point. But that could be representative of the Council for Voluntary Service, because that way you're always going to get the broadest possible representation, because somebody might say, well, actually, why can't it be X, Y, or Z, who will be particularly focused on one particular issue, say learning disabilities or and so forth. So,
I think that the phrasing is deliberately loose to allow all sorts of things in time, but I certainly think that that individual that body would be probably the body we would look to supply that representative.
Well, that's what I'm trying to ensure.
Yeah. No, I think that's right. But I think so far as terms of reference are concerned, a representative from the. I don't think there are any other players that we would be looking to.
I'm saying you always got to go to them all, Gary.
Well, but we will understand that, but if there's changes, then
Yeah.
may not. So why don't we have a representative so and so and so and so?
Yes,
I
yes.
need the broadest possible.
Well, I would hope that generally speaking, I like the groups and subgroups amongst in consensus to decide who those individuals should be if they are bodies, representative of this area or that area or the other area. And you can understand that in some of the groups there will be very widespread representation from all sorts of bodies. I don't know that we want to be as specific as a
I think it's ensuring that going forward that you've got the widest possible representation, because
And I hear that.
the CVS's job is to make sure that the broadest possible range of views are expressed.
Well, I'm open to
So that's
what the members think. We're perfectly happy to edit this.
I think it's a perfectly reasonable request. I think it's.
Yeah, no, I hear that.
Don't know issue with that.
I mean, I suppose the middle ground would be that you had a subclause at the end to say, in order to ensure the broadest possible representation of the voluntary sector. So you don't specify exactly who's coming, but you're saying that's our intent to get representation, not specific interest groups. Leaves you the flexibility, but gives you a clear sense of what you're trying to achieve.
But it's a CVS's job to do that.
Okay, let's make the edit.
There is the point here, of course, that substitutes need to be found as well.
Yeah.
So kind of feels as though you need a bit more flexibility to make sure.
It doesn't mean it's me. It means it's representatives of the Council for Voluntary Sector, and we have a substitute system anyway. We have a substitute.
Yeah, I mean, generally speaking, obviously, what you need here is to identify the individual from the description, because and that individual wants to identify at least one, and in my I always like more than one substitute, so that there's a representative of that entity in the room. Yes, indeed. So Gary, so what we want, if I cross through voluntary and community sector and I write in
representative and substitute of the Council for Voluntary Service.
Okay, with that amendment, any more suggestions? Again, I'm not going to go to an indicative. I'm going to look in the room. Those I will propose, seconded. Those in favour with that amendment? Lovely, thank you. So we'll do that amendment and then distribute. Now, what will happen is that all these other terms of reference are currently going through the various bodies to make sure that they're tight and they work for the body in question. So I don't think he's in the room, but there will be somebody coming back to Adrian on the mental health action group. Don't worry. Was looking at that yesterday, and then they will finally come here, because some of them actually contain powers to make decisions effectively on behalf of the Health and Wellbeing Board. Power back to the leader. Okay, thank you for that. Let us move on to the pharmaceutical area, which has, I think we discussed this at the last meeting. It was certainly discussed in Health Scrutiny Committee, so it is being discussed a number of places, but we have a proposal to come to you as to how things are dealt with because of experience. I think this comes out of recent experience. So I'll let April introduce the paper and talk to it.
Chair. So hopefully you all have had a chance to read the report. As an overview, health and wellbeing boards are responsible for developing and updating the pharmaceutical needs assessment, assessing any impacts of notified changes in pharmaceutical services in the area. So the paper sets out a process for assessing the impacts of notified changes to the pharmacy services in West Berkshire and for keeping the pharmaceutical needs assessment under review. So it makes several recommendations. that notifications of changes to the pharmaceutical services in West Berkshire are sent to the chairman of the Health and Wellbeing Board, to the Director of Public Health for Reading and West Berkshire, and also to the public health team in West Berkshire. Decisions about the appropriate response to notifications to pharmaceuticals to be delegated to a subcommittee of the Health and Wellbeing Board, which would include the chair and the vice chair of the Health and Wellbeing Board, the Director of Public Health for Reading and for West Berkshire, and also to include a senior public health officer. That then the subcommittee shall consult with the local pharmaceutical committee and relevant local ward members to ascertain if there is a gap in provision in order to understand the likely impact of the change in that pharmaceutical position on the local community. And then the subcommittee will decide based on the data and analysis that they do as to what required response will be. And that may be to do nothing because there's not going to be any significant impact changes, to actually re-look at the whole pharmaceutical needs assessment and to refresh it in light of whatever changes that we find as part of that process, or to write a supplementary statement in relation to the changes. So it's really just setting out that process of how we would deal with any notifications that come through to the Health and Wellbeing Board. So it's and also there's a set terms of reference for that subcommittee as well, in terms of how they will deal with that, any notifications that we receive. So it's really for the board to present these recommendations as to whether it's agreed that that's the way that we should deal with any notifications that we receive.
Yeah, thank you. Indeed, the reasoning for this new subcommittee is really to be found in the paper agenda item 11 and the desire to be able to respond to something along the lines of closures of pharmacies agilely, so that we have agility in dealing with that, because the board doesn't meet every week and things happen. It can happen the day after the board meeting. We could have one of these issues and we need to be able to deal with it and decide whether or not, with professional advice, it is not significant, that there is no gap in provision, people can still access pharmacy services, or there is a gap but it's not so great that we need to revise the whole of the joint assessment, or we do need to revise the whole of the joint because the gap is significant. So I'll now take questions and April can pick them up.
I've got no problem with the paper at all, April, but I read it in conjunction with the second paper which we've just got, and I suppose it's the so what. It's okay, we've got the notifications, okay, we've got a number of options, but the so what mechanisms can we do? I mean, rewriting a joint needs assessment isn't going to solve the problem. And I suppose for me it was, what do we do if we've got a problem? How do we escalate that? Where do we put the pressure? What do we have to respond to it? Because when you read the two papers together, great papers, no issue. But you sit there and go, so what? What is it we can possibly do as a board to rectify these situations?
So I think the Health and Wellbeing Board obviously has a responsibility to note the changes and make any actions that might come out, what we find through the analysis. But it's very much down to whether providers want to have pharmacies in those areas. So we can't physically, as I understand it, make pharmacies come and put replacement in for services that have stopped. So, but actually having those statements to say that we recognise that there are gaps, that is useful, I think, for providers that will be able to, pharmacies that might be able to look at that and identify that there might be a gap in those areas, but we don't have the power to physically put another pharmacy in, as I
So can I just come back to that? So is there a pharmacy notice board, so to speak, of all these notifications of this area is missing a pharmacy? So if I was a local business looking to start up, do I go to this pharmacy notice board where these notifications and statements are to identify where I might want to be.
So we put any notifications, any supplementary statements that would go on to the West Berkshire Observatory next to where our pharmaceutical needs assessment is placed. And I do think pharmacy providers know that we have pharmaceutical needs assessments, and they know that there would be supplementary statements linked to those. But I think that's a good question, Lynn, in terms of that might be something that we need to have a conversation with, our local pharmacy lead. Just
how proactive can we be?
Yeah, how, and I have to say, I'm not exactly sure how that process works.
Before I come to Councillor Vickers, I think I reflect that there are sort of three different roles here, different products. There's the formal legislative process role, where the Health and Wellbeing Board has a statutory process, which is to produce a joint needs assessment. That is one of the things we are required to do. This paper is dealing with that, really. This is all to do with how we arrive at that joint needs assessment, how we make sure it's up to date, how we make sure whether we need to amend it or whether we need to provide a supplementary comment or whether we need to do nothing in the context of a particular situation arising. That is our role. Then there's the role of the Health Scrutiny Committee, which, and it did at its last meeting, question the system about pharmacy closures and pharmacy provision and whether pharmacies are open at the right times. That is the role of health scrutiny. It's not our role, it's the scrutiny role to make sure that the NHS is, or the system is doing what it does properly. But we also reflect that there's a lot of private in the pharmacy system. It isn't a public service in that sense. These are private companies coming into the, and if a company decides to move out of the market, as appears to be the case and we'll come to that in the next paper, what does the system do about that? It's not the role of the Health and Wellbeing Board to decide what the system should do. Health Scrutiny can criticise and question what the system is doing, but at the end of the day, to a large extent, it's for the NHS to decide what it does about pharmacy provision. So I just reflect on why we're here and why we're looking at this paper. Councillor Vickers.
Okay. Well, that's a very, very useful clarification. So thanks to Councillor Doherty for asking that question, because it makes our response seem quite neat, really, so what's the point sort of thing. But we're still sort of where we are. So thank you for that. I mean, the process about what we do here, I mean, I don't see why we can't, for speed's sake, because there is a long gap between meetings and, having a special meeting would have to be particularly crucial. But surely we can communicate things to all the board members, because it's not just the service is closing, it's the impact of that closure on other areas, which then receives those people. And, I mean, I was going to say something about that and, and what I represent at the moment, but the impact on our one and only sort of service in the centre of the town. I mean, so it's broader than just the place where the service is closing. So I don't see why we can't have notification to all the members for information and then feeding back to the smaller group so that they, they have those opinions, if that's, just to feed in more information.
And I have to say, having been quite heavily involved with April in drafting this, I've got no issue with that at all, and we'll look at that in a moment. Let me take Heike, let me take Paul, then let me take John.
And did you forget me?
I did forget you. I'll take Heike, then I'll work it out. Heike first.
I would agree with Councillor Vickers' suggestion about it going out to board members. And also what you said, Councillor Doherty, it feels it's for information, like what can we do? And I wonder whether the extended NHS know what is within their gift or their power to help influence this, if any. Because it's more than the pharmacies consulting with the pharmacies. I think the key thing is consulting with the patients, the people, primary care. I'm sure that there may have been people around this virtual table standing in long queues outside waiting pharmacies when we had issues a few months ago, and that was for temporary closures. Temporary, and just the immediate knock-on effect neighbouring pharmacies. My other key thing that we just discussed with Rob earlier, we said that the prevention agenda is top on our list. Pharmacies, community pharmacies are going to play an ever bigger role in helping that. If we say we want to help invest primary care to do as much as they can, we need help. And that is help from other healthcare providers, that's not pharmacies. Extended hours. If we would be asking GPs to be open longer. So both of these pharmacies have extended hours of opening. So that might mean somebody not getting their medication, not getting started on it that day, needing to drive further than the 2-mile radius that we quote in the needs assessment. It certainly has a further reaching effect. So access. The other pharmacy is in one of our areas of greatest deprivation. The other 2 top things that we mentioned in our joint plan is access, leveling up deprivation. And yet again, in that area of deprivation, we want to make life as easy as possible. We want it to be accessible. If that community pharmacy is your first point of call of how you can seek help instead of slightly further away, this is an opportunity to make a difference. In very good piece of work that you wrote up there, we've got new developments. All of us can see the new houses going up. How is that catered for this? These are the 1 closed, now we're saying 2 closed. What is in 6 months' time? Can anyone give us any indication of, are there areas that are teetering? Thank you. I'm moving to the next paper.
I do have a concern, and I think Councillor Stewart makes a good point. Can I ask members to consider whether we are moving into a discussion as to what happens in relation to a specific instance, which we will deal with in the next paper, or how we deal with a proposal generally? I've taken on board the comment, and I have a proposed amendment to take account of circulating the board. But that aside, can I just ask those who are attending virtually to only leave their hands up if they want to speak to this proposed subcommittee, not to the question generally. Right, I will now take, as I've forgotten, Councillor Bowick first, and then we'll move our way through, and then we'll get on to the specifics in the next paper.
Thank you, Chairman. To what extent, and it's Christopher April as well, to what extent does the needs assessment take into account the growth of online pharmaceutical service providers?
And there I'm going to officers.
I don't 100% know the answers to that, Dominic, but that's something that obviously I can look into for you. Come back to you if that's okay.
I think there's that's part of my thinking, but I think we need to recognise that pharmacists do more than just dispense drugs, and I think that's the gap.
Yeah.
But there's also that need, which is not urgent, which is clearly known and defined by the patient, the customer.
Yeah. I think one of the things that the subcommittee should consider is targeted communication, information and advice to those affected populations. Because I entirely agree, there are ways to meet your requirement to get medication which don't rely on physically going to a pharmacy. And I think that making sure that people know about that. Now, we've got a risk in that, because the more people who move to an online solution, it's Blockbuster and Netflix again, all over again, isn't it? So the more people who go to an online solution, the fewer physical pharmacies we need, and then we lose out on the non-dispensing service that is so valuable. But I think targeted comms to the affected population about what else is out there is probably a helpful thing that the subcommittee can consider.
I'd like to leave that alone for the moment, because I'm conscious that comms piece, who is telling the population, again, we are dealing with the statutory process here. That's what we're here to talk about. We are talking about how you end up with a joint needs assessment and what you do when it looks like it might be out of kilter with what's going on in the market. The question, what do you do if there's a proposal? How do you inform the customer? What is the communication? But I think is a different question to the role of this subcommittee. Right, I'm conscious I've got quite a few still to get to. Councillor Stewart, then I'll come to John.
It's a point about that, because the next paper is something that I'm very interested in. Actually, it's about one of the points says the subcommittee should consult the local pharmaceutical committee and the relevant local ward councillors if a gap in provision is identified. And I think we should use our ward councillors and that knowledge, local knowledge and intelligence, to actually help identify that gap in provision. So I would like to see that at an earlier point, and certainly with the next piece that's coming along, it was very public, obviously, that Lloyds were stepping out of that particular market. And I could see lots of residents' conversations about making their plans for what they would do and where there might be issues. So I think the piece about self-care, which I think is so important, people do also need to be able to make their own decisions and start to process that a lot earlier. So I think use the intelligence that you've got available to you with local ward members, and then they can work on the council's behalf, on the NHS's behalf, to be honest, to start getting messages out and get people to start to work out what they're going to do.
Thank you. I take that on board. Next, John. Need to unmute, John.
Sorry about that. Thanks. I think it's an important and timely discussion because there are increasing numbers of moving parts around this now, and it really does require a strategic stock take. It's been already pointed out that we've got the possibilities of online supply, but that's usually next day. You can probably buy booze 24 hours a day from nearby, but you may not be able to get Calpol in the evening for a sick child if you're going to not bother A&E. The recent removal of Lloyds, for example, from Sainsbury's has been a very destabilizing issue, which portends other similar things probably. So there needs to be an overview that really understands what's going on, and I'm not quite sure how that's put together, but we obviously need to engage with that agenda because, as Councillor has pointed out, I mean, if we're really going to strengthen primary care, then one of the options, of course, is dispensing within extended hours health centres. I mean, my own health centre here in Sedbergh has a dispensing pharmacy in it. There's still a Boots, small Boots, in the township, but I don't know how long that'll stay there now because, what they've done is Boots and Lloyds bought up all the family-owned ones, and then now they seem to be disengaging. So we really need to have a three-dimensional picture of what's likely to be coming down the track as well as what is now. So I just leave it there, but I think this is a very important discussion, I think.
Thank you. And Fiona.
Hello. Yes, I'd just like to say that when things like this happen, with the changes that was very sudden, with the pharmacies coming out of Sainsbury's, etc., and all the other changes that people hear about, they come to Healthwatch to find out what's going on. And unfortunately, we found out that it was happening from the paper because the paper seemed to have got hold of it before we did. And it's a bit worrying that, we're kind of not being told about these things. So I would just like to say that I think that the information should be sent to board members first. It's quite important. And because of the comms, and I know you said this kind of going on to the next page, but the information currently out into the public is, if you don't go to the doctors, go to your GP, they can help you. But the people are going to the GP and they're standing in a 2-hour queue outside. And they're also being told now that they can't get their repeat prescriptions. So again, we're having all of this coming to us about pharmacies, and we don't have anything to give back to the people to tell them what's going on. So I think it's really, really important that Healthwatch is kept in the loop and updated with things that are happening. Thank you.
Thanks. And as I say, I've got a proposal which we'll come to in a moment. Councillor Masters.
Thank you, Chairman. It's more a technical, and going back to what John was saying about the landscape and what's ahead of us. What's the proportion? Maybe April can tell us what's the proportion of independents against and large chain pharmacies and NHS run. Is it all part of the market, or do we have NHS provision? And what plans do the decision makers in the NHS and other partners have for stepping in where there is that primary care, self-care need moving forward? Because obviously, if Boots and the other big players are moving in and then rationalising, it's probably the word that they would use, it's going to have an impact on all the issues that we've spoken about. So I just wondered what proportion are independent and what and NHS left.
I don't know the answer to that, but that's something that we can look at. But I think a lot of them are certainly in this area. They seem to be private providers, but the exact ratio, I can go away and find that out.
So I don't think we can come up with a plan or a strategy for a solution unless we know what the actual makeup is.
Don't forget that this paper is to do with the needs assessment. What you then say to the system, here is the need, how are you going to deal with it, is a secondary question. This is to do with getting the needs assessment right and understanding whether the needs assessment needs to be, the current needs assessment needs to be amended in the light of the current event, whatever that might be. Let's discuss the more general piece when we look at the next paper about the Lloyd's closures. So if I can hopefully take us to a proposed amendment to the paper before you. So if you can have page 65 of the pack, which is the Pharmaceutical Needs Assessment Subcommittee proposed terms of reference. Well, I propose this. At 3.2, a new 3.2 insert, details of proposals, that's defined in 3.1, shall be circulated to members of the Health, don't worry about writing all this down, I shall write down myself. Members of the Health and Wellbeing Board and local ward members, so that they can provide relevant comments for consideration by the subcommittee. Then what is currently 3.3 would move up, and what is currently 3.2 would move down. So because 3.2 will simply become an introduction to 3.4, which details what you do, whether there's a gap or not. So you need to define gap first. The new 3.3, because we're moving the ward members up the chain, if you like, would now have all that wording at the current start of 3.3. 3.3.1 would remove the and or at the end. And 3.3.2 would simply say consultation with the local pharmaceutical committee, full stop, because we would have already consulted with the ward members earlier on, right at the outset of this. We'd circulate to the board and to the ward members so that organisations like Healthwatch had a chance to come back and individual ward members had a chance to come back.
So Healthwatch, is that included specifically?
Well, because they're a former board member, they're always a board. Healthwatch is a statutory board member, okay. So they would get it. So they would always get automatically notified. Right? Does that find favour? I am going to look for an indicative vote because we've all had a chance to comment on this one. So before I move to a formal vote, could I ask those who are attending virtually to put their Zoom hand up if they agree with what's just been proposed? I see a sea of hands. Excellent. Thank you for that, everybody. So I will now move to a formal vote in the room. I will propose, I'm going to look to April to second. Thank you, April. Those in favour of that as amended. Thank you. That's agreed. So we now have a subcommittee, which would normally meet to look at the next paper. But since we're here and we've got the paper in front of us, we'll discuss the changes in the local landscape, because Lloyd's have decided to come out of both of the Sainsbury's, the one in Calcutta and the one in Newbury. The paper reflects that the impact on the market is subtly different in the two cases, and therefore there are different proposals in relation to the two cases. But I do remind everyone that this has been through the mill at health scrutiny. So the health scrutiny have had a go at pharmacy. I invite those who haven't seen it to watch health scrutiny committee back, because it certainly had some airtime in that meeting. But now I'll look to April to present.
Thank you. So this very much does lead on from the conversation we've just had about process and how we deal with those notifications. As a result of the notifications, we were notified that the Lloyd's pharmacy in the Sainsbury's in Calcutta Superstore there, and the Lloyd's pharmacy in the Sainsbury's in centre of Newbury were going to be closing. So this prompted us to do the two things: to look at the process that we need to have in place and how we deal with it, also to deal with those notifications that we received. As a result of that, there was a look at the pharmaceutical needs assessment, and a few of us met and also liaised with the analytical team from the Berkshire Shared Public Health team, who put the pharmaceutical needs assessment together to look at the implications of the closures of those two pharmacies. And as you'll see from the recommendations, were that it was felt that once we'd done the data analysis, that the impact wouldn't be so strong in the closure of the pharmacy in Sainsbury's in Newbury. So therefore, there wasn't any action that needed to be taken from our perspective in terms of refreshing pharmaceutical needs assessment or issuing a supplementary statement. So we felt that one, because there's lots of other pharmacies within a very close proximity to that one, that no further action was required. However, with the closure of the pharmacy in the Calcutta Sainsbury's, there it was felt that a supplementary statement would be required to the closure of that pharmacy. So the paper kind of sets out the recommendations, and hopefully quite self-explanatory in the fact that we feel that we need that supplementary statement, and that will be shown on the West Berkshire Observatory next to the pharmaceutical needs assessment.
Members, I'm always happy to have debate, and certainly we will look to Councillor Stewart as one of the local ward members for comment. But let's just bring us back to the role of the Health and Wellbeing Board and the role of health scrutiny, which are different, quite rightly. Health and Wellbeing Board, and be corrected by Otters, is here to look at, in this case, the process, the legalities, what we should be doing as a board in relation to joint needs assessment, and whether we should be looking to amend, update, refresh, renew, whatever, or not, as the case may be. In other words, we would be doing all of those things that we've just debated in relation to the subcommittee. So with that in mind, let me start with Councillor Vickers, then I'll take Councillor Stewart, then I'll come to Sean. Councillor Vickers.
Thank you. Thanks, April. Yes, I mean, it's still a very, very useful discussion. I note in this paper that it says this 4.6, the spare capacity in the other pharmacy in the area. I mean, I represent the town centre area, so where there's supposed to be this spare capacity. And I've put in queues there, and it doesn't feel as though there's much spare capacity. And I've seen brought pharmacists to cope very well. There's increasingly long queues with elderly people sort of leaning on the sticks and whatever. I mean, it's a lot of pressure there. And as has been pointed out, by how, the other services that the pharmacy offers are pretty crucial in this self-care that everybody's talking about. So it's a wider thing. And we are the Health and Wellbeing Board, so that is something that we are concerned about and that we consider. So it is very appropriate for us to be very, very aware of that, to be including that in our discussion. So it doesn't feel to me as if there's much spare capacity really there. There is the 4.14. It does talk about the development in that area and how that will increase the pressure on the town centre services. There's a lot of building going on in the town centre. And although I recognise the deprivation around the Calcott area, we do have some pretty, poor pockets around the centre as well. And people for whom that pharmacy is very handy, very close, near to them, having to trek into the town centre is more difficult for them if there are other people. So I think, there are pressures there too. So although it might be lesser, it's still some consideration. So I find that have to be recognised in any feedback that you're giving on this commission.
April, do you want to take comments as they come, or do you want to let everyone have a chance to speak and then try to draw them together at the end?
Maybe it might be easier if I deal with them one at a time, if that's okay. So thank you very much, Councillor Vickers, for those comments. And and I think you do make some very valid points in some of the things that you've raised in relation to that. And I suppose it just goes back to the process that we follow in terms of making those recommendations in terms of which process we follow. Whether we don't have to make a statement, whether we do need to make a supplementary statement, or as to whether we need to do it refresh. But I do very much take on board the comments that you've made, because any closure is obviously going to affect residents, isn't it, in their access of the pharmacy. But we kind of did the data analysis. We looked at the pharmaceutical needs assessment and did feel that further supplementary statement wasn't needed for that particular pharmacy. But that's not without saying that I totally accept the comments that you've made.
Councillor Stewart.
Thank you. I think the first thing that I would like to say is to, and to have it put on record, is to thank the staff in the Lloyd's Pharmacy in Calcott. I have been using that pharmacy ever since I can remember. And I've lived in Calcott for well over 20 years, using it for things like needing to get medication for my daughter when she was a baby and those sorts of things. So those staff have done an amazing job, and I think they probably have been subject to abuse at times, as have many pharmacy staff, and certainly I know from experience, I've witnessed it in Tyler's Triangle as well, because people were so frustrated with queues, etc. So I totally understand that we're in a situation here where what we are doing is, I guess what I will be doing is representing my frustration, I guess, that we're losing another service, whilst understanding that there is not very much that we're able to do. I think one of the things that I wanted to point out is, and apologies, because as a ward member, I did get to see this information ahead of the game. So it means that the process is already underway, which is great. As did one of my neighbouring ward councillors, because it doesn't just affect Tilehurst Birchcroft, it also affects Tilehurst South and Holybrook. And actually the people that are mentioned, or the residents mentioned in Beansheaf and Forth Farm, actually come under Tilehurst South and Holybrook, and we have an area of deprivation there as well. So I think we should recognise that it's not just one ward with that deprivation, it's actually two. We are lucky in some ways that I've said this ever since I became a councillor, being on the periphery of Reading Borough Council and that area, my GP surgery has always been in Reading Borough Council because it's just up the road, and it was particularly the best place for me to get the care provision that I needed. But that doesn't mean that everybody is able to get that access. I'm looking at you, April, only because you're the author of this paper. I really just want to get the points across. We will have people that will struggle to get to some of the other areas and some of the other pharmacies. A lot of people I know, particularly elderly residents, could get on a bus that would take them to to the Sainsbury's, and they could do their shopping and go and speak to the pharmacist and get their medication at the same time. We are lucky, and I'm mentioning all supermarkets, so Sainsbury's, Asda, as is mentioned in the paper, also just along the way. A little more difficult to get to because it's not on one bus route. So if actually you're not able to walk there or drive there, then that will also be an issue. As I said in the previous paper, because this was so public, and as Fiona mentioned, certainly from Health Watch's point of view, also from a local point of view, we found out through the press as well. And as I say, a lot of people then started, there was concern to begin with, but generally people in the area said, oh yes, but I've always used so-and-so, so perhaps you could use those. So people have started to think about what they can do, and some of them will probably have moved to an online sort of provision because that is easier for them if they're not able to access another pharmacy. So really, I just wanted to make sure that we knew that this is 2 wards that are actually affected. Thank you for giving us the opportunity to see that. And I had spoken to the other ward member just to make sure that I've represented his views as well in this conversation. And I'll leave it there.
Thank you. And I reflect that my family first started using Sainsbury's in Calcutta 38 years ago.
No, you beat me.
And I'm not certain. I'm trying to remember. I think pharmacy came into the store after we started. I'm sure they didn't have a pharmacy when we first started using. So no. It's been a long time, but it had been a long time. But in the day when it was behind the tills, not in the centre of the store. Just reflection.
I was only a young girl then.
Yes, quite. Next, Sean.
Thank you, Chairman. I've got an observation and a question. I'll try not to stray into the scrutiny position. But obviously, I mean, as many members of the board have talked about, obviously pharmacies play a hugely important role in terms of primary care provision, and obviously that's been promoted over the years. And in my time, I think in West Berkshire, as a lot of people on this board who live in West Berkshire will know, we've seen a number of pharmacies close, and we can probably remember the ones that were around a few years ago. I think my concern is in terms of the impact. There obviously is an impact around accessibility in terms of people's travel distances and everything else. But I've also got a concern about the impact on the remaining pharmacists to deliver those very important added value services, the advice, the support, and everything else that comes. Because even if you look at just the closure of these 2 particular pharmacies and looking at the statistics, that's still 13,000 prescriptions that have to be dispensed elsewhere in the system. And obviously people who go to pharmacies, and I think we've talked about everybody around this board will, have seen some of those capacity issues and the impacts potentially on added value bits of the pharmacy service. An example of that being something like the ordering of repeat prescriptions, which is very, very important to some residents to have that ability to order that at the time when they collect a prescription. So I think there's something for me about how we measure impact and going forward, because I think obviously there has to be an impact with 13,000 prescriptions being dispensed elsewhere. There has to be an impact on the level of service that others can deliver. My question is this. There is a figure at 4.15 in the report that talks about the proportion of pharmacies per 10,000 population in West Berkshire being at 1.1, as opposed to the national average of 2.2. I've not got the paper in front of me, but that's my recollection. And my question is, do we know why?
With regard to that, Sean, thank you for all those comments as well. And, obviously from a public health perspective, it is important, that a lot of the comments that Joe has raised, Councillor Stewart and Councillor Vickers, and also that Sean, you've raised as well, we would agree with, those comments, because it is important that our residents do have access to some of these really important services. So Sean, in relation to the ratio, I think, again, it's very much about whether providers want to come to West Berkshire and have a pharmacy here. And maybe, I think that's the crux of it, and as to whether they want to continue providing services.
Chair, may I just come back on that, because obviously we would like pharmacies to come to the area. The question is there anything we can do really to encourage that? I don't know. I've obviously only been on the board a couple of years, and I'm not sure what work has been done in the past on that. But we're in a decline in terms of numbers, and I don't know what the numbers were 10 years ago, but obviously clearly we've declined even in the last year in terms of numbers, and we need to do something to not just halt that decline, but to reverse it. Because obviously the important role, I'm sure John will probably come in a minute and tell us about the role again, and it is a hugely important role that these play, not just in terms of health messaging, but as community focal points as well.
Yeah. Thanks both. I've got quite a few people still wishing to speak. Councillor Masters next.
Thank you, Chairman. I want to elaborate on what Sean's just said. He's mentioned some of the points. I've got a couple of questions of process and statutory roles, etc. The local pharmaceutical committee, what powers do they have? What influence do they have? Going back to what Lynn said earlier about the, we get the information. What can we do? What can they do? And what can we do to assist, aid, and embolden that? I'm really refreshed that Sean's focused in on the 4.15 and the ratio of pharmacies. And this comes back to my question around the data that I asked for April about and that we didn't have to hand. And it may indicate that we need to do either through the scrutiny or through this board an examination, a task group about what the state of the market is, and the points that Sean very eloquently made about encouraging the market to come here. And if we can't encourage the market, then with the present setup, look at what those causes are. Is it high business rates? Is it other outside influences, or internal to the gift that West Berkshire has, that we can encourage people to do, to bring private. Is there the need to bring pharmacists in and open again the family based, that we know that have been taken over by Boots and others. So, I think there's a valid case to look at why the market is failing, because that's clearly what it is. The market's failing, and while Boots and Lloyd's are going to be able to absorb and restructure themselves, that does not help members of our community. Chairman and Joe spoke about how central that their local pharmacies at Sainsbury's, for example, have been over the lifetimes of themselves and their children. So that affects, and 4.13, where it talks about the area around Colcock, Sainsbury's, one of the most deprived areas of the country, and those health outcomes are going to be impacted negatively right from the get-go, and that pharmacy branch closes. So I think there's an urgency, and when it may be way over the gift and the remit of this board, but we need to be pushing up through through the board or whoever has the ultimate responsibility for the provision to make sure that we are providing for our learning communities, because it's quite clear if we've got half the pharmacies of the national average, yet the demand is higher. It shows further in the piece that the demand is actually, in terms of numbers of prescriptions, is 20% higher. So there's some trade-off between individual dispensing requirements and need and the needs of the wider community outside prescriptions. So I think we should look at that, Chairman. Yeah, I think listening to the members around here, yourself and Joe and others, we seem to be in broad agreement. We've got not a great picture, and we need to do something about it.
I hear all of that. Firstly, I would say that in terms of deprivation, I would not describe any part of West Berkshire as significantly deprived, in the sense that we have no LSOA within the bottom decile of the index. So the lowest ranking LSOA within West Berkshire stands at 27,000 out of a total of 32,000. So, I'm not saying that there aren't areas of West Berkshire which have deprivation. Clearly there are when one looks at the index, but I would always be wary. And Tyler's Birch Copse is in the 4th decile. So there's 30% of the decile of the LSOAs below Tyler's Birch Copse. That isn't to say that Green and Thatcham Milteith, Tyler's Birch Copse, and Tyler South and Holybrook, which are the 4 of our LSOAs, which are in the bottom 5 deciles, as opposed to 92, which are in the top 5 deciles, don't have issues, and we shouldn't be addressing them. But I would be always wary of describing any part of West Berkshire as one of the most deprived in the country. On the subject of the engagement of the Pharmaceutical Committee, I will say that Pharmacy Thames Valley, which is the Pharmaceutical Committee for this area, has clearly been consulted, and I'm sure I've looked to April to confirm that they're embedded in this report and in the engagement in this report and what the report is proposing. And indeed, if you go to the Health Scrutiny Committee, as I say on YouTube, I'm absolutely certain that Pharmacy Thames Valley were in the room for yes, and Gordon nods, were in the room for the discussion and debate about this particular instance. Now, I still have a lot of people to get through, so bear with me. Dominic, Councillor Boakes next.
Thanks, Chairman. I'm going to make a pitch here, if I may, for online pharmacies. During a period of time leading to the 1st of April 2010, it was my responsibility to order and collect a whole raft of medicines for my dear wife. I was lucky that I could walk to the pharmacist, so that was good. What I found very quickly was that you can't always rely on pharmacists holding stock of drugs when you need them. So I got into a process of conducting an inventory on a Monday morning and ordering enough medicine to make sure that we had a week's supply of stock at any time. That job through an online pharmacist is dramatically more reliable, secure, and easy, and can be used if you live 3 miles from a pharmacist. So I think it needs to be part of the mix.
Yeah, and indeed, the nature of that is one of the things I think that is leading to the market pressure within the system. And we need to discuss what needs to be addressed and how it needs to be addressed. Next, I'm going to go to John. And you'll need to unmute, John.
Yeah, no, sorry, I've done it. Sorry, I was a bit slow, No, an important point. And of course, if you can cast your mind back to the fuel protests in the year 2000, one of the things that they demonstrated was the fragility of the pharmacy system caused by just-in-time stocking. Most pharmacies only carry enough stock, including hospitals, for 2 days or something like that. And that's part of the weakness in the system now, the just-in-time stocking. So just 2 or 3 points, really. I mean, I think if we accept that the shift to self-care and primary care, which really needs to be put on turbo drive, there are parts of Finland where they've reduced primary care consultation by over 20% by systematically educating the public about managing common conditions for themselves. But the quid pro quo is having strong primary care, and pharmacy is part of primary care. So, you know, we've had things being pushed in opposite directions here. The government is very keen to promote the extended role of pharmacy, but then we've got this rationalization. So there's a conflict of business model here. Councillor said, you know, it's market failure. I think it's a contradiction of the market model. And what we need to do is see where the levers are that we can pull. So I'd refer us back to the ICB strategy, because the ICB strategy is important here in being able to assure pharmacies of the business flow that can enable them to meet the margins thereafter, because that's part of the problem here. They need the confidence to invest and to have the distribution of pharmacies, knowing that the business will be there for them to stay in place. Chairman, you mentioned inequality, but the other driver here is the demography. So older people, and particularly frail elderly, and particularly people once they've given up the car and are dependent on public transport, or, you know, if they can't walk to the nearest pharmacy and so on, you know, they've got problems. So we need a whole systems strategy for this. And so for the Board of Health and Wellbeing, as you keep pointing out, it's important that the board keeps an eye on what its responsibility is. But I think we've got to manage up as well and make sure that, you know, higher levels of administrative bureaucracy and so on do what they need to do to support what it is we're trying to do at this level.
Thank you, John. Valuable. Gary.
Thank you. I mean, clearly commerce is having its way. I mean, we don't have any statutory powers, it seems to me, but somebody must have some statutory powers. Everything's been articulated by Councillor Stewart, Councillor Vickers, and what Sean's had to say about provision. So if we can't actually do anything other than persuade, and if notwithstanding what the Health Scrutiny Board may have done, but I think we should at very least write to the authority, in this case the Lloyds, to say this is how we feel about these particular closures, expressing and articulating everything that's been said in here, because there will be some requirement upon them as NHS providers of prescription services. Somebody will have some say, but if they go back and say, well, we've gone through the process, we've consulted the local authorities and so forth, and they just accept it. But so we need to write to the MP as well, and then the MP can then take it up with the NHS providers as well. So I don't think we should just lay down and accept it as having no powers, because I think we have the powers of persuasion. So I would like to propose that we do at least write to Lloyds at the highest level, not just the sort of local area management level, because then they know how we feel at the very least. Because we're looking at the banking situation, they've taken the line of least resistance if we've not said anything. So like the bankers, we'll only have one banking hall left. We're not telling as well.
I mean, I do think that there is a question as to what does the contract say? What is the contract between the provider, in this case Lloyds, and the NHS? Because after all, you know, scripts are coming through the NHS in order to be delivered. That's the principal piece we're talking about. Alongside, which then leads into all those other pharmaceutical services that sit beside it. And obviously then there has been a period of notice here. You know, I think this was 6 months notice, or 3 months, I can't remember one or the other, under the contracts. The question is, you know, what is the contract saying, and what ability does the engager of those services in the form of the NHS have? How much ability does it have to do anything if someone decides to come out of the market? And what do you do about a lack of provision if a lack of provision then entails? So I have absolutely no issue with what you suggest, and I think I see a lot of nodding around the room. So I will say that yes, we will. I think if you'll leave it to April and me and possibly Sarah as the vice chairman to construct something relevant and ensure that we get it to the right person through the good offices of Gordon, of course. Yeah. Yes, another bit of work for you, Gordon. Never mind. So I'll look to April to put pen to paper, and we'll start to work from there. If everyone's in agreement with that, everyone is.
Thank you. Just a few last points, which sort of labours a few points. You know, so if the needs assessment says the neighbouring pharmacies can accommodate, and 6 months or 9 months down the line it's proven negative, you know, that they can't cope, or there's so much sickness, or you can't fill it with locums, that means that we will need to review what we thought was capable and people could accept. I just want to sort of safety net that element. And then importantly, the unintentional knock-on effects is those medications need requesting from primary care. It needs changing of provider and all that. That is a work all in its own. Completely agree with you know, the opportunity for online pharmacies, but there's a role for that, and possibly in chronic conditions, repeat prescriptions, because where it fails is if anything is required today or a guarantee for tomorrow, it can't cope with that. As we said, you know, you can get Amazon deliveries within 2 hours, but it is still not that good. So the unintentional knock-on effects in the rest of the system is really important to take into consideration, not just can the pharmacies cope with that. We're living in a time when there's lots of striking. Striking has impact on deliveries and logistics and things like that. I just think that the wider system, and Councillor Marcus keeps pointing out, and 100% agree, what is around the corner? You know, with our new developments, what population do we expect that to be? Sort of younger families? How many care homes are we expecting to go up? All these unintentional things are around the corner that will have implication on what we say is sufficient right now.
Thank you. John, is that a legacy hand, or do you want to come back in?
Just a quick point, really. I was taken by the analogy with the banks, because you know, it is a similar situation. What we've had there, especially it's not just in rural, but in towns as well, obviously, is that eventually the government has put pressure on them to collaborate to make sure there is a banking presence, perhaps through the local post office where they've not been rationalised. But so there is an analogy there about where the private sector is brought under pressure to provide a public service that's equitably accessible. So I think, you know, there's a precedent there to think about, I think.
Thank you, useful. So, members, I think that concludes the discussion. You have before you, if I start by taking you to paragraph 5 of the report, which says what the options available to this board are: refresh the needs assessment, issue a supplemental statement to the needs assessment, or do nothing. Those are our options. And if you look to 2, these are the recommendations: to note what's happened in relation to Lloyd's in Calcutta and Lloyd's in Newbury, to note the impact, to agree that we should be issuing a supplementary statement in relation to Calcutta and taking no action in relation to Newbury. So that is the proposal. Now look for an indicative. I will propose.
Before we do,
Councillor
is there not an amendment to this proposal in the fact that we've agreed that we'll actually write and take action?
Yes, and I will add an E to write as a board in the form of the chairman to Lloyd's to express concern.
Yeah.
And all appropriate words in relation to
about both.
About both, indeed, about both. Yes, absolutely.
Just as regards to the one in Sainsbury's, I mean, I know.
Sorry, Sainsbury's in
Newbury. Just to say, when we have expressed concern about, in the not too distant future, the effect of growth on the service, and we have said that although it's not as crucial as the one in Calcott, that we do have concerns. Can we not sort of qualify our comments in some way there, rather than just saying, oh, there is no need, everything's fine?
I think, yeah, so obviously we've done the analysis based on the formulas that we use, and we felt that supplementary statement wasn't needed at the moment. However, I think part of our responsibility as the Health and Wellbeing Board and the Pharmaceutical Needs Assessment is to keep looking at it and to make sure that it represents the current situation. So I think we noted that there may be population changes in that area, and as you said today, things may change in the future. So I think that is part of our responsibility to keep looking at that pharmaceutical needs assessment in relation to what's actually happening in our district as well. So I think that is something that we would do. And obviously, if things become more of an issue, then certainly we can look at that. That should be part of our responsibility.
I just point out, just looking at the sort of nitty-gritty of the report, it said it only takes 12 minutes to walk from the Sainsbury's Newbury to the other service, Boots. Well, I don't think that's quite accurate. It'd be an extremely brisk walk, I think, and certainly not a walk that somebody older would do. It would take them some time. So it's quite some distance. I'm just thinking of it myself. I think brisk walk, very brisk walk, and 5 minutes drive. Well, we all know what it's like driving around the town. You'd sort of be, you just don't do it unless you have to. So 5 minutes again sounds a bit optimistic. So particularly the walking side, that doesn't seem to be a very accurate assessment.
I think it's probably an average, used as an average assessment, but again, it's completely feeds into inequalities, and that's not going to be exactly the same for everybody, because everybody wouldn't walk or be able to walk, at that speed. So I think it is a good thing, but I think there's just it's assessed on a formula. I think Sarah looked at the way these things are calculated, and that's how it's calculated. But totally accept Councillor Vickers that that may be brisk, very brisk, and some people may not be able to do that.
My recollection, please correct me, is that the pharmaceutical needs assessment is refreshed. I've got 3 years in my head and I don't know why. Right.
Yeah.
So the actual document is refreshed every 3 years. So I would hope that upcoming development, knowing what's on the books, knowing what the profile of that development is, trying to make some assessment of the population of that development and the demographic of the population of that development would be in the planning cycle, would be built into the 3 year assessment in any end, because this is all to do with, on top of that 3 year assessment, what do we need to do in a particular situation, in this particular situation. So one would hope that the 3 year cycle would take account of that changes to the landscape generally. So members, you have the proposal at 2 amended to add a new E about writing to Lloyd's. Indicative vote of everyone, please, including those outside the room. So everyone in favour of those proposals, in and out. That seems to find favour across the piece. Thank you. So I will now look, already proposed by me, already seconded by April. Those in favour in the room? That is carried. Thank you. So we have an agreement. Good. Right. We move on to an item which isn't here for discussion, but is here to report to you, which is item 12. And you have a paper on young carers, which is an update on what's going on. I know Dave's done a lot of work here, and indeed there is some changes to the way in which the subgroup that looks at the young youth is being amended. So that's coming forward, and you'll see that when that amendment comes forward. So I ask you to note the report as you are asked to. Next, we on our standard agenda, we have members' questions. I don't think we've had any.
We've had no questions.
Gordon shakes his head, so that's that one. We now move on swiftly to the forward plan for the board, which you have right at the back of the pack. Is there anything one wants to raise the forward plan? Okay, no, it is there for you to note. I think that future meeting dates have been listed in the agenda. They've now been published. So we've got the 23-24 municipal year meeting dates. And that therefore concludes the meeting, which may be my last. I don't know. We'll see what the voters of Burfield and Mortimer have to say about that, and the voters of the district in its entirety have to say. But as I said at the outset of this meeting, thank you all for your attendance. Thank you all for engaging with the board, and I wish us all very well. Close the meeting.
Thank you.
We also